to charitable funding, the hospital is able to run initiatives such as Pets as Therapy. I am one of the Pets as Therapy volunteers. I volunteer and come into the hospital each week with my Labrador Jackson, and it's really been one of the most fulfilling things. It has such an amazing impact on the patients, the staff and us as volunteers as well. I've been coming here for the last year, and we will typically go to the stroke ward, the children's ward, and I've just got so many examples of meeting patients where they might have not expected to come into hospital, they might not have many visits from family members. Many of them will say to me that they have experienced really difficult days, but they don't necessarily have an outlet for that emotion, and actually seeing a therapy dog and having a cuddle for a couple of minutes just really makes their day different.
We've been able to bring in this new set of mammography screens, which have been hugely beneficial in reducing our reporting times. I think prior to the screens it could be up to a month, sometimes 6 weeks for people to get a report for surveillance mammograms. We've brought that down to within a week or a few days now, so it's been a huge advantage for us. That radiology screen is between 2 to 3 megapixels and is similar in cost, between £2,000 to £3,000 for a reporting setup. Whilst mammography machines, they pick up much finer detail calcification, so you need at least 5 megapixel screen, and that can be an enormous difference in picking up tiny dots of calcium, which then will lead us on to a biopsy. Sometimes completely incidental. Frequently within our clinic, patients will come with symptoms of pain on one side of their chest, when actually we're picking up something on completely the opposite breast, and these are the early signs of cancer which aid us in a detection and have a huge impact on patients' treatment. We've been extremely grateful that the charity have given us a huge amount of funding, around £50,000, to implement a new technology called contrast enhanced mammography. This is going to be essential for women with dense breasts. This is a much quicker, more tolerable technique compared to breast MRI, so it opens the door to increasing our availability of imaging for patients with dense breasts.
Funding that we've used to buy a new FibroScan machine that you can see behind me for Kingston Hospital for our Department of Hepatology. We have a growing number of people with liver diseases in the community, and it's important we understand how severe someone's liver disease is. FibroScan is a non-invasive way of assessing fibrosis, so liver disease severity, and we can monitor people as well over time. This scanner is much better than our previous one in that it's portable. We can take it around the hospital, and in the future might be able to take it to the community so that we can scan people nearer to their homes. Also, because we can get really sensitive details about how severe someone's disease is from doing this, we have to do far fewer liver biopsies, which is an invasive procedure where a needle's put into the liver to take a sample, requires people to be in hospital for many hours for recovery afterwards, whereas with the FibroScanner it's a few minutes for the procedure. People can walk out and carry on with their day.
In the emergency department, the charity have kindly funded a CorePulse CPR device for us. It lives here in Resus, and what it is it's an automated CPR device which delivers chest compressions during cardiopulmonary resuscitation.
We see massive benefits of having this CorePulse already in the few months that we've had it in the emergency department, and we've also loaned it to other departments. If they have a cardiac arrest which we think is going to be prolonged, we can put it in a backpack and we can run it up to the wards, to ITU, to assist them with their CPR as well.
Chest compressions with the CorePulse are much more effective because it's delivered by a robot, it's not delivered by humans. So when you're doing CPR, you get something called rescuer fatigue, which means the rescuer delivering the chest compressions is by a human, so they inevitably get tired. So it's very, very physically demanding to deliver chest compressions. The more effective the chest compressions, the better outcome for the patient ultimately.
Multiple sclerosis bladder scanner has made such a huge positive impact for our MS patients. Having access to the scanner in our MS nurse clinic means that we can assess bladder problems immediately and take prompt action that's definitely had a real impact on our patients' comfort, confidence, and quality of life. And it also helps reduce the pressure on the wider NHS. So previously, when a patient will come to clinic and report some bladder issues, I wouldn't be able to do the bladder scan. I will have to send a referral to the urology service, which may take several months just for the patient to have a bladder scan, an assessment, and then actions taken. So definitely, thanks to the bladder scanner, this service has been streamlined, where the patient comes to my clinic, reports the symptoms, and straight away I can measure if they are retaining urine, what exactly their problem is with the bladder scan. It takes less than 5 minutes, and then I can take action. So that definitely has had a massive impact on patients' lives. We are incredibly thankful to our donors. Your continued support helps us to continually improve care. Thank you so much.